So good afternoon, I'm Dawn Castillo, and it's my pleasure to represent NIOSH and in the next few minutes share with you some of the specifics of our involvement in youth safety and agriculture over time. Oops. So first, I'd like to provide the briefest of introductions to NIOSH to provide the context for our involvement. NIOSH was formed in 1970 by the Occupational Safety and Health Act. We are the federal agency that is responsible for conducting research and making recommendations for preventing worker injury and illness. The Occupational Safety and Health Act also created OSHA, that is responsible for establishing and enforcing regulations. And one of NIOSH's roles is to conduct research that can inform standards and regulations. So this slide shows the framework for occupational safety and health regulation and research. On this slide, I've shown relevant agencies in labor and health and human services. For simplicity's sake, I've not included the Department of Agriculture, but clearly they have a role to play. So OSHA and the Wage and Hour Division are both housed in the Department of Labor, and as most of you undoubtedly know, OSHA has traditionally had limited authority over agricultural operations. NIOSH is housed in Health and Human Services in the Centers for Disease Control and Prevention. We have a sister agency in CDC that is responsible for injuries that are not work-related, the National Center for Injury Prevention and Control, or the Injury Center. NIOSH and the Injury Center work together very closely on areas of mutual interest, as well as those areas in which the distinction between work-relatedness is murky, such as youth safety and agriculture. The NIOSH mission is to generate new knowledge in the field of occupational safety and health and to transfer that knowledge into practice for the betterment of workers. I wanted to touch upon NIOSH's role in a few timeline events that Brad Ryan and Barb Lee have both mentioned. Brad previously noted the NIOSH Agricultural Initiative, which began in the early 1990s. I think it's important to note that from the beginning, NIOSH incorporated issues regarding farm families in our research and outreach, not limiting our work to rigid definitions of workers. We recognize that the farm is a work environment and that exposures to production hazards are not limited to workers per se. NIOSH staff were involved in the Surgeon General's conference that Brad discussed, as well as a follow-up symposium focused on childhood agricultural injury prevention that Barb mentioned. Barb also discussed the National Committee for Childhood Agricultural Injury Prevention and their development of the 1996 National Action Plan. Staff from NIOSH, as well as our sister agency, the Injury Center, were both members of this committee and contributed to the development of the action plan. Our involvement ramped up significantly with the release of the 1996 action plan, which called for NIOSH to play a lead role. David Hard, who was part of the committee and continues to play a key role in the NIOSH Childhood Agricultural Injury Prevention Initiative, is participating in the symposium. In fiscal year 1997, NIOSH received an appropriation for a Childhood Agricultural Injury Prevention Initiative. We developed the initiative based on the National Action Plan recommendations. We held a public meeting to seek stakeholder input, and then we refined the plan. In Barb's presentation, she noted the development of subsequent action plans based on assessment of progress to date. NIOSH has made periodic adjustments to our initiative, including refocusing calls for research grants based on these updated plans, periodic NIOSH requests for stakeholder input, and assessments of continuing research gaps. While we have refined our initiative over time, the overarching goals have remained the same. They are to fill critical data needs, to provide an infrastructure for translating research into practice, and to encourage the use of effective prevention strategies by the private and the public sectors. So the initiative rests on three pillars. The first is the establishment of a surveillance program to provide consistent, valid, and reliable data on childhood agricultural injuries to guide both research and prevention and to track progress over time. We established a system that utilized existing data, and we collected previously unavailable data on multiple at-risk groups. You will hear more about this surveillance effort and be provided with some of the data in a presentation by David Hard later in the symposium. We also established what is primarily an extramural research program. We have funded more than 35 grants since the initiative was first established, including several evaluations of educational efforts and curriculum, which is especially relevant to this symposium. This research portfolio was built through a combination of targeted funding opportunity announcements, which were influenced by research gaps identified in iterations of national action plans, as well as NIOSH general funding opportunities that reference NIOSH research agendas. The third pillar of the initiative is outreach. We have worked hand in hand with the National Children's Center that Barb Lee leads to ensure that findings from the initiative are communicated to stakeholders and translated into practice. We have funded the National Children's Center to conduct research, but also to play a specific role in outreach and translation to the private sector, including farm families and farm organizations. NIOSH's outreach efforts are focused on other federal agencies, academic researchers, and our traditional stakeholders. It's like me trying to operate my cell phone. So I'd like to continue with the timeline by noting a couple more recent NIOSH initiatives that have influenced and complemented the continuing NIOSH Childhood Agricultural Injury Initiative. The first is the National Occupational Research Agenda, or NORA, that Brad referenced. It was first established in the mid-1990s to provide a research agenda to guide the nation. In the second decade of NORA, which began in 2006, industry sector-based councils developed industry-focused research agendas. This includes a research agenda that's specific to agriculture, forestry, and fishing sectors, which includes goals specific to more vulnerable populations, such as youth and agriculture. And very recently, NIOSH established an initiative to promote a safe, skilled, and ready workforce. This initiative aims to ensure that all workers have basic skills that they need to stay safe on the job and to contribute to a safe, healthful, and productive workplace. This initiative encompasses a long-standing effort to develop and test curricula for use in educational and group settings. Our existing curricula includes some agricultural case studies. And recently, we've undertaken pilot efforts with local 4-H groups to test the feasibility of using parts of the curriculum in their program, and we're interested in exploring the extension of these efforts to the national level. And then additionally, an academic partner in California has developed an agricultural version of the curriculum. And Carol Stevenson, who has led these efforts, is participating in the symposium. So the NIOSH initiative has contributed to a large volume of products that have been used to guide research and prevention. There have been more than 100 scholarly articles based on research that have been conducted by NIOSH or NIOSH-funded researchers. And the research has been cited and referenced in countless articles and research proposals. Shown in this slide are just a few examples of NIOSH documents, which include web pages with downloadable data, investigative reports of youth who were fatally injured while performing farm work, brochures developed specifically for farm operators with recommendations for making their farms safer, a summary of research that's been funded by the initiative, and the NIOSH curricula that I previously referenced. I'd like to wrap up by giving you a teaser for some of the data that will be presented later in the symposium by David Hard. We have seen reductions in the rates of non-fatal injuries among working youth over the life of the Childhood Agricultural Injury Prevention Initiative, which is very encouraging and rewarding. Progress on fatalities is less consistent. The collective efforts of those in the room and our extended networks undoubtedly contribute to the progress that has been made, and I'm confident that by continuing to work together, we will see future strides in the future. Thank you.